Hi, my name is Dana Hernich and I'm very interested in the physical therapist position at Kinetic Chain. So let me tell you a little bit about myself. I've always been very interested in physical therapy and continued to pursue that interest as an undergrad when I completed a full-time internship at Craig Hospital. I really love the opportunity there and being able to help people through their rehab and get back to the quality of life that they had before, and so I continued as a full-time employee until I went to PT school. While I was in PT school, I pursued a lot of different interests, and one was holding a leadership position at our Bridge Clinic, which was a student-run pro bono clinic for those in the community who did not have insurance. So I was the first person that they saw when they walked in, so I felt like it was very important to make a great first impression because they came out of their way and it was hard for them to get there, and so we wanted to make sure we showed them that it was worth it for them to come and for us to help treat them. And while I was in PT school as well, I had 3 clinical internships, one in the acute care setting, one at the VA in Tampa in inpatient and outpatient spinal cord injury, and the other in a cash-based outpatient clinic. I learned so much in all of these clinicals and had incredible mentors, but really learned the importance of teamwork and having that open communication and working with other therapists, physicians, healthcare providers, and the patients and their families. And one very important thing that came with the communication was the education, whether we were educating other physicians, providers on what we needed to do, what we needed to see and get done, or helping educate the patient and their families in knowing why we were doing what we were doing and what was important for them. And I felt like this was very important in outpatient because they are spending majority of their time out of the clinic living their normal lives, and we really had to get through to them. And so I really felt like I improved upon this during my clinicals. And so let me tell you a couple of reasons why I would like to work at Kinetic Chain. One is the fact that it is a cash-based clinic, and I feel like that is so important as a therapist these days, being able to have the freedom of having that cash pay, because I feel like we can give the best quality care and the greatest value of care if we aren't necessarily dictated by insurance standards. And so this being said, I also think that the patients come in and they really truly want to be there. They're paying out of pocket to have this therapy, and so they are motivated, they want to get better, they will do what they need to do to get better, and they're really open to what you would like to do with them and the education that you want to provide to them, and they really trust you because they are paying cash. And so another reason why I would like to work here is the learning opportunity. When I was in the cash-based clinic, I really went in not knowing what to expect because I knew it would be different, and it was very different. And I worked one-on-one with my CI every day, addressing any questions that I had, any skills and techniques that I wanted to learn or improve, and really help grow my abstract thinking and those clinical reasoning skills, and to be able to provide the greatest value to the patients because it is so important. And I feel like as a student in this kind of setting, I was at a huge advantage because I was so open to learning anything and everything new, and that's what made it so exciting. It was very different from school, and that was the best part. And so I'm really excited to continue learning and continue that growth in really being able to give the patients exactly what they need and exactly what they want as a new grad physical therapist, and having that freedom to use what I learned in school and use my knowledge in order to treat my patients.